Greetings, this is Timothy Young's the Digital Apothecary, and today I'm going to be doing a video talking about telecontraception companies. So if you see me in my other videos or in articles I've written about online, I've been following direct-to-consumer companies, which are basically these direct-to-consumer prescription companies, or DTCs as I call them. And I've been writing about basically their growth and how they've been going about things. Probably the two areas that they're probably the biggest in right now is contraception, in which case there's a bunch of companies for that, and then I would say sexual health, especially with a focus on erectile dysfunction. So you probably know of companies like Nurx or NewRx, Roe, Hims, Hers, and many others. There's so many of these companies, and I keep hearing about new ones that come onto the market. And it's quite interesting because I always grade these things as there's like low state conditions, which to me are basically things that are almost over the counter or very easy to treat diseases because it's almost like a flowchart algorithm. If this, then that. So if they had this condition or this kind of subset of issues, don't do this. Or if that, then you do these things. So usually the nice things about these conditions is that you don't need that much objective data, to be quite honest, that need to be like laboratory assessed or vitals for some of these things. And as such, these patients can then just put information online, go through an online questionnaire, and be kind of like screened out if they can't be treated. Or what they can then be done is then they can say, yeah, you can get treatment. So there has been not that much information out there in terms of the accuracy of these companies. And I had always thought that there might be coming a time when someone's going to do an investigation on them. I was thinking they would do like erectile dysfunction because that seemed like one that has a lot of press. But surprisingly, while I was doing some lit search work on digital health, I came across an article published in New England Journal of Medicine last September, or 2019 September, that was titled "A Study of Telecontraception." And I wrote up an article, so it's online on my website, The Digital Apothecary. And I'm going to highlight some of these things. And the reason why I like this is because it's a set methodology. There's been always these times when people will kind of come through and they'll basically do like a secret shopper approach, which, there's some issues with that. If you are in the pharmacy space, you're probably familiar with the work by the Chicago Tribune that has looked into drug interactions and basically going to a pharmacy with a prescription with like Coumadin and also bringing aspirin to the counter and seeing what happens there, or like other drug interactions. But in this case, because these are remote companies and they're telecontraception or direct to consumer, they could basically just contact them remote. So what happened was they created 7 standardized patients. And what's interesting about these patients is that some of them had relative contraindications to certain treatments, and some of them had absolute contraindications to the treatments. And those included women who basically were just postpartum, who had a history of DVTs, and also one with hepatocellular adenoma. So they were putting together these conditions to see if these questionnaires to screen them out, and if, whether or not these companies would prescribe for those patients with those contraindications, along with what else was like the services. And then they approached 9 telecontraception companies. This was back in 2018 based on a methodology. And just to give some background, this is not actually a full study. It was published in New England Journal of Medicine. It was a correspondence, which is like less than 1,000 words. So there's not a lot of information if you just read the correspondence. If you want a lot of this information, you have to pull the supplementary file that's also available on the website. So just a heads up if you're trying to see where I'm pulling some of this information from. The 9 companies that they approached with these 7 standardized patients was Planned Parenthood, NewRx, Project Ruby, Virtuwell, Lemonade, The Pill Club, Pandia Health, Hey Doctor, and Maven. So those were the 9 companies that they went to. In terms of the results, I would suggest you read it. It's really short, but there's something that I want to highlight because I thought they were quite interesting from my perspective, just in terms of applicability to maybe other DTC companies. And so 7 of the 9 companies require the use of the website. Only one really required the use of an app, and the other one either. So, this whole idea that you can go through your smartphone and basically sit on your couch and do this process may not completely be true. It may be that you have to go through a web browser minimally and not through an app directly. Would the app be the end all be all? I don't think so. I think it's just a web-based approach is what is really convenient. One thing that got me was that 3 out of 9 companies did not require a patient-provider interaction after doing the online questionnaire. So some of the companies immediately after doing the questionnaire would be the patient would be approached to do a follow-up, or could be through video, could be through chat. But 3 of the 9 did not do anything. So that's quite interesting. That do the questionnaire and you're done. That's it. Like, there's no follow-up. Interestingly, the authors saw that some of the standardized patients did not like that because they wanted to have that interaction. So again, it's a small sample, only 7 standardized patients. So this could be larger, so it's hard to screen out. I haven't seen any surveys from patients saying would they rather go in clinic, talk to someone, or they want to do tele. So I haven't seen that kind of literature out there, but we're going with a small sample. The interactions that would occur varied across all the different companies. Some were very small in time, some were longer, but on average it was only 7.5 minutes for these interactions. So you can imagine just sitting there typing all the information, filling out the questionnaire, and then doing a follow-up interaction. These things are probably taking less than 15-20 minutes. That's really convenient. I mean, like, you can do that from your home. You don't have to get in the car, drive out to a clinic, sit in 15 minutes for someone to come see you, do the appointment, and afterwards get the prescription, drive to the pharmacy. You're looking at losing a whole afternoon through that process, and not to mention scheduling, just making that time. Here, you can just reach out and get it done. And that's really convenient for some of these patients, and that's why I think it comes back to this whole mentality of retail health, treating healthcare as a retail space where you want a service and get out and get on with your life, and not being basically subject to the whims of the healthcare professionals who will dictate the whole process. Rather, it's the consumer who's going to be the one that's dictating what should happen for them, and they're going to shop, and that's why you have all these companies. Patients are going to shop around. And then the one thing that got me was that 6 of the companies then offered to mail home, and if I can recall, like, the medications were mailed home within 3 days to a week, or a little bit more. Now, from a pharmacy standpoint, some of the other companies were basically going to e-prescribe it to a pharmacy. The patient would then go pick it up. The fact that 6 of the companies allow you to directly mail to the patient home implies that they have contracts with someone else. They're not relying on the outside pharmacies. They're going to someone else. Now, there are some other startups in the space, like TruePill, for instance, is one that services a lot of these DTC companies. And I think some of them are going through that. But then I wonder if some of them also have, like, in-home pharmacies that they're using. I think Hims and Hers is going to open up their own pharmacies in the future here soon. So you can see that they're kind of really packaging it all in one. And I've heard some people call these DTC companies like online pharmacies, which I think is bunk. And the reason why I say is because it's not really a pharmacy type thing. It's more or less, it's a prescription service. At the end of the day, that's what it is. It's not really so much the drugs. The drugs is what the patients want, but this service is more about getting that prescription. It's not like you go to most pharmacies and say, I want birth control, and the pharmacist gives it to you. That's only for certain states. There's limitations even with that. This is what's overcoming, I think, that whole hump. And again, come back to this whole retail health mentality. Now, the authors did kind of hook onto some certain points. One thing that I thought the authors mentioned was the fact that none of the companies asked patients about their medication adherence. And if they were supposed to say that they actually had poor adherence. So that was never even tackled, which, is something that we should be discussing with patients if we're going to be prescribing them oral birth control. The other thing is only 2 of the companies also discussed alternatives. So that would be intrauterine devices or subdermal devices. That only 2 of the companies actually gave the information. Those were other options for the patients, and they never really popped up for the other ones, which I think is kind of Okay, let's go in this direction. It's basically like if you know that there's that you want birth control or you want any kind of product, you go out to a person and they're going to sell it to you. I think you would hopefully, from a provider with that relationship, want someone who was going to give you all the options and walk you through about which ones what is pros and cons for each ones and what's else out there. But if you're working and you only have a certain amount of options available, is it your duty then to discuss all options or only what you provide, and therefore dictate what the patient has access to and can go to? I think this is something that's worth exploring or talking about further. And that's something that I think might be missed here, especially if you just go into these things as just to get a service. I often think that these DTC companies don't want you to be a patient. I think they ideally want you to be able to enroll in their service, pay for their service, get the prescription, and be attached to the service and be mailed it without any complications or things to follow up. And that's why you would aim for low-stake conditions, because ideally then you don't have to deal with patients with significant complications. Like, I think that's why mid-level conditions like depression, mental health, cardiometabolic, there's a lot of things to go on there that I think is not so clean cut. And that comes back to my whole discussion at the beginning of like this whole flowchart analogy. In any event, in terms of cost, average cost for the visit was $0 to $49. Some of them had insurance options. And in fact, if you were contraindicated for care, they wouldn't even charge you for the visit per se. The average price for a 12-month supply was $313 uninsured, with a range of $67 to $519. For 12-month supply, oral birth control is offered by some companies cheap, CVS, Walmart, and a few other have like $4 or $9 lists that you can go to for like a 3-month supply. Might be about $12 plus. So looking at this, these might be a little bit more expensive, but then it comes down to the whole aspect of convenience. And these standardized patients were supposed to say they were uninsured. So insurance, if they cover it, I'd be curious about how much the price would drop then from that perspective. Now, to contraindications, some of these patients, as I mentioned, had their profiles had issues. And what they said was that 93% were adherent to CDC MEC guidelines in terms of like avoiding these issues. So they still found that several of the patients were prescribed medications they should not have been. So I think one relative contraindication was prescribed for one patient, and one patient that had some absolute contraindications still, some of the companies were prescribed agents they should not have been on. So those did happen, which we can probably infer that there's still some work to do. And I think that comes back to the one example they put in there was the hepatocellular adenoma. Was basically trying to see, do these companies even look at these kind of rare contraindications? So it looks like some of them do. And I think this is a good sign. I think what we would find is that companies who really have really good data analytics and then can screen out the stuff in the questionnaire would probably avoid patients that would have any issues. And then going forward, these patients then would be fine on the service and there'd be no complications. And the companies that don't put patients on drugs that they should be that are contraindicated, that then have these complications such as maybe a DVT, bleeding, etc., would probably get bad press, look bad, and then patients would flee them and go to these other companies. So I think that's where all these options come into play. It's a lot of it's marketing, it's all of it's going to be accuracy, and then downstream in terms of how they deal with, if they screw up clinically, how to deal with repercussions of patient issues, whether it's lawsuits or bad press too, which I suspect the other companies would then harp on and pile on them just to get them out of the game, because there are a lot of these companies, and they're going to have to figure out how do I stand out compared to my competitors at the end of the day. So to me, I think these are very interesting aspects. The fact that these visits happen so quick is, I think, a very positive thing. I think it's going to really meet my generation and younger, who most of us don't even have a primary care provider. I haven't seen mine for the past 18 months, I think. I should set up for an annual wellness visit at some point. But in any event, what it comes down to is, from the design aspect, very interesting. I think the authors even walked away saying, okay, this is rather, we didn't find anything too damning here in terms of being bad. So I think that's a good sign. So maybe this stuff is really good. And that's one of the comments the authors had was basically these things might be better than like in office visits, which I think from a small sample is still hard to gauge, but it's worth just thinking about. So that moves on to these other conditions. I would really like to see this repeated with ED, with migraine, and with mental health conditions, because those I think rise to more of a mistake conditions, or more towards like maybe more things that might be going on, like the skin, like hair loss and stuff like that. Okay, I mean they're there, but I think the other ones could have some interesting things to follow. ED would probably be very easy to do, but the mental health one and the migraines I think would be much more complicated. I'd like to see how those companies are managing that. So in any event, this is just my assessment in terms of these direct-to-consumer companies, and also I think this article is very good in terms of just opening this discussion in terms of just how should we treat and how should we look at these companies, and maybe we'll see some bigger articles and bigger studies come out in the future. So in any event, this is Timothy Young's, the Digital Apothecary. Take care and have a good day.